Good evening from Hong Kong and Taiwan. Welcome to the second episode of the online series of Asia's Post-Pandemic Healthcare, organized by the Institute for Health Policy and Systems Research. I'm Jeffrey Liu, founder and chairman emeritus of the Institute and host of this series. Co-hosting this evening's program is Ms. Elaine Chan. Elaine, say hello.
Hi.
She's a board member of the Institute and a health insurance expert in Hong Kong. She is currently an entrepreneur in developing a new platform of healthcare delivery and payment in the private sector. Joining us tonight are Professors Yaw-tang and Zhang Dongliang from Taiwan. Please say hello. Hello. Welcome. They are expert advisors, policy influencers, researchers, and educators in public health, systems development, financing, and management. Professor Shi, affectionately also known as Stone by his many friends, colleagues, students, and fans, has had a distinguished career in the government. He served as Deputy Minister of Health at one time and was instrumental in formulating and implementing Taiwan's much acclaimed national health insurance. Professor Zhang Dongliang, as we normally call him, of course, is another prominent figure in Taiwan's health system. Among many of his important contributions, he was former Dean of the School of Public Health at the National Taiwan University. Stone and Tony, as you know, Asia's health systems in the past decades seem to have made tremendous strides in enhancing and protecting people's health. But for factors that we'll explore later in the program today, areas such as improving equity and access, costs and efficiency, quality and outcomes of care, governance and management, and also institutional arrangements continue to remain clear ongoing challenges for many. We have many strengths and vulnerabilities, of course. COVID-19 has highlighted and made these much more visible than ever. What do you both see are the unique aspects of Asia's health systems and its most notable accomplishments in past decades? And what areas where clearly advances and improvement should still need to be made or worth making in the coming years? Stone, let's start with you with these two questions.
Asia, a region whose economic, social, and cultural diversity raises most of the policy issues facing health sectors in any country. Policymakers, particularly in times of crisis, such as COVID-19, are faced with a challenge and opportunity. The challenge is to protect the poor and elderly, as well as women and children, from the consequences of poor health, but the economic crisis also provides an opportunity to implement significant policy change that is sometimes particularly invisible in terms of related time. It is an opportunity to strengthen and refocus activities directed toward the poor, to liberalize the regulations governing the private sector, to increase public support for prevention programs, and to improve the quality of clinical care through strategies that increase competition or link payment to clinical services. Even without the crisis, the issues facing Asian policymakers or region. Nearly two-thirds of the world's population lives in Asia. Over 400 languages are spoken. And Asia's economies range from the richest in the world, such as Japan, to one of the fastest growing China, to some of the poorest like Bangladesh and Nepal. In addition, Asia is experiencing the demographic transition to an older population such as a result of a decline in female fertility and an increase in child survival, which has led to epidemiological shift toward chronic diseases such as coronary artery disease and cancer. Simultaneously, Many Asian countries still face persistent problems with infectious diseases such as tuberculosis and malaria. But later on, I would say new emerging infectious disease will be new normal. Clearly, Asia mirrors many of the most important health and policy development issues that face the global health sector today. Asia's struggles and successes provide lessons for policymakers everywhere and reflect the massive policy challenge that all countries face.
Well, thank you very much. I think that's a very nice recap of a lot of the things that we have done in Asia, plus also the challenges that we're facing. Let's hold on with our questions for now. Let's go to Tony. What are some of your summations of the good things we have accomplished and some of the challenges that we still are facing and we need to address them in the future in particular?
Well, that is a big question. It's difficult to answer in short time, okay? But I'll try to do it. I think the first one is the Asia economics is growing without questions. And the second is the democratization also goes on, okay? And those both are good things. However, we are facing three areas. The number one is the social equity issues is very important, as mentioned by Professor Stone. The inequality issues will make things getting worse. And this is this disease, like the COVID-19, is not individual issues, it's population issues. That means the rich peoples would also suffering if they don't, the poor people didn't get well protections. Okay, so that's the number one. That is the social equities issue there. The second is right now, so we have globalizations, and this one was also very serious one because the transportations, the communication was so quickly. So it's not like the currently like those old days. Many things would last for example, we can have like in Taiwan, in the past years, when the south part of Taiwan get the infectious disease, for the dengue fevers, it's take more than 1 week to reach the Taipei. But right now, it's almost the 1 day arrive. And we know the COVID-19 issues is in the China's, but quickly it goes to the Europeans, goes to the Americans. Now, within 1 year, we have second waves, and probably some will goes to the third wave. So the globalization, the transportation was so quickly. This one would make us headache, okay? Because how to protect it. But if we slow down, we have the shutdown, lock the country, lock the cities, then it's hurt our economics one. So you see, in the we have finished the Americans president elections. The two candidates, Trump and the Biden, their debate also in this point. So the communication, the globalized traveling issues was very serious one. And the third one is urbanization. Urbanization is a big problem in Asia because, 200 years ago, we only have 1 million populations. Right now, we have close to 8 million populations. The population goes so quickly in Asia, particularly in India, in the Indonesia. That is all the Asia phenomena. And since the people's move from the rural to urbans and gather together and so many populations, so it's good for the infectious disease to to happen, to grow up. So that is we have the face the issue of urbanizations. So the inequality, particularly poverty issues, the globalization issues and urbanization issues, all will contribute to our futures for the prevention and control of infectious disease.
Those are very significant issues. As you mentioned, it's not easy to address all of those or even give it the depth and breadth that we should deserve. But nonetheless, let's go with go to Elaine and see what questions she might have conjured up with two very powerful introductory comments that both of you have made.
Right. Very interesting to hear two professors at different perspectives in today's health situations. So I have a first question to Tony. It's about the three important learning this day is like social equity, like the populations versus previous year, and globalizations. What do you think? This question is also a very big one. What do you think how we can do something to prevent or manage what you mentioned about the three issues, social equity, globalizations, and populations?
Well, the fundamental issue is our health is the product of our society. Okay, so the society is the issues we have to deal with. But how to deal with? We have experimentals in after World War II. We have the communist, we have democrats. Okay, but we know it seems in the 1990s the communist was collapsed, and we think the democratic was booming. Okay, but right now it seems the democratic society also faces some issues. You know, the issues, not only the communist society face the issues, and how to solve it, I don't know. I have no answers, but I only see the problems. Okay, but problem is good for professor. Okay, that's all.
Do you think, because we're always talking about here in Hong Kong, we're always talking about starting basic primary care, preventive, is this can handle some of the issue that you mentioned? Because the issue that you mentioned is quite globalized. It happens everywhere in the world. And then anything like a World Health Organization can help out to promote, to manage the preventive, because the social equity, I totally understand. You have money, you can have all the treatment, but if you're poor, you cannot. So those kind of things, that globalization, you can infect everywhere. Is this something like WHO can do, or something we should promote a bit earlier?
I think all the international agencies have some responsibilities, just like every country and every peoples. Okay. However, this is some kind of values. If we are has a brotherhood, or we are act like we are family members, that will be more easy to to solve the problems. But if you are under, for example, the capitalist societies, and everyone think about making money was the final goals, that will be problems. But on the other hand, we have the authoritarian societies, and we lost our freedoms. That's what also we don't want to be. Okay, so it's some conflict. We are in some kind of transitions. We need something like a middle ways. You know, we have a good parents, but we should like as a family and live in the democratic families. So that is the issue. So it's some kind of called communism. That is some kind of socialist, but it's not like the traditional communist society. It's not also like the capitalist society. We need some middle way.
Well,
Right, I agree.
I'd like to, Elaine, I'd like to inject with a question that I would like to direct to Stone, because I think he touched on that in some way. I think I'd like to highlight this and ask Stone to comment on this. You know, in our early episode, the first episode, when we met with our Singapore colleagues, one of the things that was mentioned by Professor Jeremy Lim was that in the past, Asia has really been able to exploit the science and technology of healthcare. So we're able to treat and deal with illness and diseases, and therefore we have gained quite a bit in that area. So we actually start from close to 1 or 2, and we quickly move up to a scale of 5 or 6 or even 7 or 8. But then from 8 to 9 or from 7 to 9, it would require a very different approach because the challenges are different. It's no longer about clinical care. It's about human behavior. It's about all of the other aspects we frequently talk about as social determinants. So if we want to go further, it's not just the technology, it's not just the science, it's people's behavior. You know, we talk about healthy lifestyle practices and those things. How do you see this being an issue that we have to deal with in Asia in the future?
Theoretically speaking, I would just say 2 objectives. Number one, lifespan equal to health should be for all. Lifespan equal to health should be for all. Second is all in health policies. These 2 things are very important. Then through health literacy, make healthful living become daily habitual domain. How to do that? We should health system reform for one formula called 3H plus 5P minus AD. Again, 3H plus 5P and AD. What AD means? Because we are now in the flying geese paradigm of an aging population. Like sequential by low birth rate, aging population, decrease of labor force, and population decline lead to, I just mentioned, 8 Ds. Number 1, death. Number 2, disruption. Number 3, deprivation. Number 4, disease. Number 5, disability, discomfort, dissatisfaction, and death. This is AD. Then we should have health evaluation. Everyone knows how the health condition. Then health literacy, that people know how to promote their health literacy. The third one, health promotion. So under the health evaluation, you should have personalized, not public health, because now we have precision preventive health services. So second P is prediction. Then under the health literacy, you should prevention and participation take you on, and also promotion. There's 5P. So 3H plus 5P minus AD. So all of the health system reform should within this theoretical framework. Otherwise, just dear disease cannot solve the problem at all. Mm-hmm. So health system reform, working with this concept, this I would like to elaborate. So health in all policies and lifespan equal to health should be for all. should be the future direction for all of the country to do that, according to the development transition.
Okay, Tony, do you want to follow up with comments on this in this area? We have accomplished a lot because we have been able to successfully deal with the science and the technology of healthcare. But I think in the
Yes,
future, it's not just about science and technology anymore.
I think that our thinkings is more advanced than before. Okay, since the last centuries, we all promote the health for all, and we know the social determinant of health and make it in the first priorities in the early 24th centuries. And also at that time, particularly after 2015, we have the UN SDGs. We always think the universal health coverages right now is the right and is some kind of the goal we have to reach. Okay, but this is we already know, and how we to realize it, because we have faced many challenges. I just mentioned we face the challenges of inequality, we face the globalization, we face the urbanization issues. Okay, I didn't mention the crime change. That's also big issues. Okay, but we only within the social part. And the issue is now the change, the social change, the technology change, everything was so rapidly. The speed is very quickly, and the magnitude is so big. So you know, like the in the 2003 we have SARS, but SARS we are very serious, but it ended very quickly because the scale was not so quickly at that time. But right now the COVID-19 is, you know, nobody think it's only in the early January. It's so small one, only in the Wuhan, but now the worldwide, and even the United States every day has more than 10,000 people was diagnosis as the case. So wow, we have to think about shall we slow down our path? Okay. The pace, our pace shall slow down, and how to reduce magnitude. Okay, and that is, I think, is at this moment is some kind of challenge to us. We have to think about that. I don't have the solutions, but I can make it short. Make sure I'm quite sure this is a tough issues. The speed is so quickly, the magnitude is so big. These two issues, how to solve it? Like, you know, we use it. Like tonight, we use the rooms, meetings. You know, that is very difficult. 20 years ago, even 10 years ago, it's a very difficult one. Okay, so maybe the solution also can counter it, but the source of challenge also so rapidly and so big. So that's two. I really I don't know what will happen. Okay, but for sometimes I enjoy my childhood life. I think it's poor, but you know, it's more easy one for me. Okay.
Okay. All right. Stone, you actually provided some suggestion of what the changes that we should make in order to address those issues that Tony mentioned. One of which is, you know, policy of health for all, you know, or health in all policies. Would you want to comment on that and elaborate on it a little bit more? I mean, obviously, this doesn't seem to be the case in the past. We had talked about it quite a bit, but it doesn't seem like we are actually doing it as thoroughly as we should want to.
Taiwan is facing demographic change and medical progress, which inevitably increase health expenditures. The long-term sustainability of the Taiwan NHI, National Health Insurance system, remains a concern. The healthcare system, and the national health insurance system in Taiwan need to be transformed. The fundamental reform should not only focus on reducing the financial burden for providing equitable and inclusive healthcare, but should also accomplish a state of high-value health all citizens. The reform should aim to create value-based, result-oriented competition through efforts from all parties concerned: healthcare providers, health plans, suppliers, consumers, employees, and government. They must be established adequate measurement for social welfare and integrate systematic hierarchies and bureaucracies responsible for population health. Ultimately, health investment and cost-effective resources allocation improve the health of the population, also accelerate national advancement. So we lack not just GNP, we should have GNH, gross national happiness. So finally, I would use 4I to have an indicator. Intentionality. How the working staff, healthcare, their intention put into the humanity and bioethics, not just science and technology, also imagination and innovation, intentionality. The second is the integration. Everything should put together. System should be integrated, not individually. And third one is implementation, not just talk. Try to implement in the community level. Mobilize all the community forces to do something about health and social welfare. Finally, your index should be your objective and your final result together. Using these 4I to measure what the health outcome, not just by how many people die, how many people are sick. Change the mind to have a new indicator to describe what the intention to do, what integrated, what implemented. And finally, I would like to say, we have a lot of high tech from home and daycare and the hospital, how to integrate it. From home, you can have a scientific intervention, but you also change the people's habits. Try from that level to integrate home, community, and the hospital together.
Sounds great. A lot of food for thought. Elaine, anything to follow up from you?
I like the 4Is. They're very inspiring about the 4Is and totally agree. Talking about intentionality, integration, implementations, and even like index. This is the whole process to make the healthcare success. And I love the integration very much. And actually, I love all 4Is. First of all, I think for me to interpret intentionality is something like what in the government mind, or even what in the patient mind, or even what in the general population mind, what they want to go for. This is sort of aim. And the integration is very important. Nowadays, no matter everywhere, especially I think Hong Kong as well, everything has so much of innovation here, but bits and pieces, they never be integrated. And also the population is not integrated together, or even not engage with the general populations. Implementations is very good as well, because we're talking about this day, everybody just talk, may not be executed thoroughly. And last, the index, talking about how you make sure you're working very well, test and go for the improvement. This is all the things that we're talking about. Hey, I have a question for both of you, Tony and Stone, because if we just see what we have this day in COVID-19, I thought every of the country is being suffered. But exactly, there was some new normal, which you mentioned earlier, like telemedicines, like population medicine, or even precision medicine, those kind of big things, how we want to evolve the healthcare. What do you think after this COVID-19, the healthcare system, or well, the healthcare should be involved in the future?
Long consider problem complicated, very simple one. Lifestyle, from the start from community. Not very technology intervention. You just have surveillance system, you have mobile people, and I would say a sentence, collective freedom, individual responsibility. That's very important. How to share together, wear mask, social distance, and other habits, wash your hand. Very simple, but very tough to do that. So collective freedom, that's a real democratic society. I'm sorry, the United States, everybody free. So once again, collective freedom, individual responsibility is terribly important. How? Using the value and cultural aspect to become the nationwide movement is very important.
Okay. Very good. Well, I have to make it as a slogan, collective freedom, individual discipline. This is very good slogan, yeah. And what is a real, Tony,
yes,
on the post-COVID-19, any evolve in the future?
Well, the Stones mentioned something very important is, it's not the individual issues, it also is collective issues. And so there are some fundamentalities. Values has to reconstruct our social values. Okay, we like freedoms, but it's not an individual freedom only. We like the collective freedoms. That is a very important one. So it's under some constraint. We don't like the authoritarians. We also, right now we know, like a capitalist in the societies, there are too much individualism. We need some compromise. Okay, so probably is the value is we are family members. That is very important. We shall feel brotherhood. Okay, I don't know, only brother sisterhood also. Okay, but this we are family members. That is the second thing is like Stone says, everything contributes to the health. So the issue is not the health sector issues. It's beyond health sectors. And so that means we need some governance for health. The government for health is not health governance only. We need many people work together. For example, economic is very important. Without economic, and Hong Kong, Taiwan, particularly Taiwan, is one of the top 3 countries. We have longer working hour in the world, longest working hour in the world. Okay, but if you to see our economic keep going up, but our average wage is so flat, so the gap is become so wide. The money goes to some people's and not distributed to other people's. That is not our family's idea. Okay, so that is very important. And also, if you are living in a poor area, the areas 25 years ago in Taitung, for example, in Taiwan, the East Taiwan, and compares to Taipei, the economic gap still maintains. So if you maintain the economic gap and other things, you cannot reduce the health gap. So it's a need to other sectors to help us. So we are in the health sectors. So we need to do something. We not only do our job good, we have to advocate these issues to other sectors. We have to persuade economic sectors, labor sectors, and other sectors. We have to work together, okay? The third one is more important at this moment. We call it so-called post-fact society. Post-fact. That means in the past, we say action speak louder than words. But right now, words are speaking louder than action, okay? That's very dangerous, you know. If we don't rely on the evidence, we only rely on our show, like tonight, okay? Jeffrey, okay, we maybe speak good words, very beautiful words, but you know, what we need is action, not only words, okay?
Okay, let me follow up on that. I totally agree with you. Let me put the question in somewhat of a different context for all of Asia, and not just focusing on Taiwan or Hong Kong per se. What changes do you think we need to continue, and what kinds of things we should discontinue? Because we cannot move forward carrying a, heavy luggage or baggage with us. Can you share with us why you think that way? What should be continued and what should be discontinued in the future?
Because
not just words, action. Okay, that should really be something. But what should we drop? What other things should we continue? We have been successful, but I think we're confronted with enormous numbers of issues, particularly if we want to advance our health and protect our health in much more effective and efficient ways.
One point I would like to make is when you deal with resources allocation should based on 3 criteria. Number 1, crowding out effect, number 1. Second, trade-off constellation. Third one, opportunity cost. So every country in terms of health, you have limited resources. How to do that effectively, distribute effectively. So crowded out effect, trade-off consideration, opportunity cost count. But doesn't matter how complicated, the government intervention should approach to collect market value. Market value means 3 basic things should done. Number 1, value the most health for the least cost. Second, guarantee an amount of health service for everybody. Number 3, provide the most overall welfare, including health, for individual and society. In addition to these points, I would like to mention 2 other very important concepts. Number 1, not individual super quality, excellency should be the system-oriented, system performance. Deal with COVID-19, not individual excellence, is system performance. So system performance should be emphasized. That means technological integration, organization effort. The second one should be 3B. Number 1B is beyond the hospital to community. The second, not quality, it deal with value. The third one, that's healthcare, it's for health. Then put all this together, then deal with the local condition, health different, country different. We don't have one simple answer, but I would have put this for the consideration.
You know, Tony, as all good professors would do, they're always very inspiring, but they're usually short on the practical aspects of how do we get to where they have inspired us. Do you have any suggestions for us?
I think that, you know, the people's, I mean, the worldwide, not only in Asia, in European, in American, okay, we have moved more. This because this is a time of best. Also, it's a time of worst. Okay, so we see something. You know, before the 1978, we don't take actions to protect everyone's health. Okay, but since the 1970s, yes, we are moved to the one, and in the turns of the 24th century, we set up millennium development goals. That is a very important step. Everyone really take actions, and not only in health sectors, but other sectors too, together. Now, in the year 2015, we have the SDGs 17, okay? And among them, I think some are very important ones. The first one, I think, no poverty by 2013. That is impossible, but we should reduce and take care of those who are most miserable one. Because that is very important, and we can do it because our society is more rich than ever before. But how could we have people, you know, in Taiwan, in Hong Kong too, in the 1950s, our GNP is less than 250. That means we have less than $1 per day, okay? But right now, we see the Hong Kong is so rich, okay? So I think we can share, but how to share? Okay, that is the issues. We can do that. In our health sectors, we also did a good job. Since the year 2010s, we have carried out universal health coverages. Okay, many people, many countries, we are moving the same directions. But we have to remember one thing. Not cover everyone, but not everything. What to cover, we have to decide. And usually the most powerful one would be save water, the garbage treatment, and have a decent job, such kind of things. We already know that we happened that in the 1929, we have the Great Depression. Since then, we know that we have to build up the social security. We have to build the welfare state. But, you know, after the 1980s, the direction changes. We go to more promote liberalization, and that will cause some problems. So on the one hand, we know where we to go, and we want to keep that one. But on the other hand, the social forces drive us toward another end, how we compromise that one. And like everyone's right now, you know, we are not wanted to get all votes. We wanted to get over half of the votes. That's dangerous. You know, if you get the half of the vote and you become the president, then another 49% people will suffer during this period. Luckily, we have opportunity to vote against 4 years later. But you know, that's the big issues. So that is very important. But I would refer to professor. Professor has social responsibilities. The responsibilities is to create knowledge and to, you know, we publish our social observations to let the society to see it. I mean, the society particularly is the other society, not
Sure.
the rich one. Okay, and we need there to voice. They voice out themselves. Do we create platforms for those poor, for those disadvantaged peoples to voice out? But sometimes this one will conflict our social values. How we do it? We need the greater 思想家 the thought to lead us. But right now, it seems, you know, those who are in humanities was been looking down, and for the engineering and for the business was going up. And that is some things. I don't against them; they are going up. But we also need the humanities, you know, put in front of them. Okay, that is my.
Well, I appreciate those comments, and you know, we're all professors in one way or the other, and I think you are suggesting that I think in addition to imparting knowledge, it's also our responsibility to begin to impart or perhaps help nurture wisdom with people
Yes.
that we associate with, especially our students. Wisdom is the most valuable part. Knowledge is easy to gain today, particularly with the advent of internet technology, etc. So I like to just add that bit to our conversation. Now, I have a closing question because we're always short on time. Elaine, do you have any comments?
Yeah, exactly. I have a closing questions for two professors to comment. Okay. The last 45 minutes, I think two professors have given a very holistic view about the future of healthcare and very, very inspiring. So we mentioned about like aging population. We talking about social equity. We're talking about globalization. Those kind of things are holistic that we have to focus on. So quick win for me. Elaine is always looking for quick win. What if you ask you, because so many priority over there, we treat ourselves as a family, everything, so many things to do. If you two have to pick two important priority we have to fix now, what you are going to do, and what kind of resources to focus on these two priority?
Stop.
Go ahead, Tony. You seem to have some words that you want to utter.
The one is that's very important. As a professors, what's my priority? Okay, the number one, I think is our job is to create knowledge, new knowledge. That is our expertise. Okay, so we have to do that one. But as you say, the knowledge and the solution is second to our high goal. High goal in terms of traditional Chinese, we say 传道. That means you wanted to have a dream of the world, okay? It's some kind of, you got the values and you have the ideal social image, society images. That's we need to do that. So we shall not only teach in our classroom, or doing our research in our lab. Okay, we have to work out the ivory tower and to serve the communities and to you know to cross to the peoples, listen to the peoples, and put the people at the center of our heart. That is very important.
Stone, any comments
Okay,
from
number
you? What are
one,
the two things?
I would like to mention HEL here. How to train people have this concept. Catch a real moment. Number one, H, I have it. I have it, have. Number two, H, E, enrich. What you have, you enrich the meaning for that. A, observe. Observe that, become yourself. Okay, L, linkage, to link other things together. Then, training every people can do this, like meditation, everybody practice it. Your life will be healthy, your life will be happier, number one. Second, severs. We have S, silence. Every day, morning, silence. Think about it, conversation we got with yourself, silence. A, affirmation. V, visualization. E, exercise. R, reading. S, screaming. 16, doing that. Finally, we should have nationwide cap knowledge toward the health, itemized. Like climate planning, you have knowledge of climate planning, then if KAP, attitude. Have knowledge doesn't mean have attitude. Attitude to practice, KAP. Finally, you practiced. We should develop the skill to do something about like smoking, quitting, or any other things. You should keep study. In terms of health, you should have the successful aging index, how to put into itemize, then measure it. You can diagnose what about the situation we have now and do it in policy level. So we should develop KAP for the health.
Okay. Elaine, if you don't have any question, I'd like to finish this session with a couple, with a question, a very simple one for each one of the speakers. Do you have any comments you want to make at this time, or should I go ahead? All right. For Stone and also Tony, what two characteristics would you like to see that the health systems in Asia be comprised of 20 years or 30 years from now? How would they be different than today? Two or three things, if you can summarize that very succinctly. What do you like to see that will be different in the future than today?
We mentioned a lot about the primary health care. That should be real. Every country should start from community grass level. That's very important. From there, we start everything.
Okay.
Mobile people pursue the health.
All right. Fantastic. Tony, anything?
I think for the futures, because already set the target there. So universal health coverage for primary health care, I think that is certainly we shall reach the goal. Okay, but because health is the downstream, I always say it's a dependent variables of many independent variables like economy, politicals, and other things. Okay, so we have to train the health professionals to be wide-minded and have the broader views and have the skills to participate other sectors, to advocate what we need and to work with them, and so reach a better governance for health.
Well, thank you very much. I have a new name for you, Stone. I don't think you're a stone. I think you're a bedrock of wisdom. So we got to change your name to Bedrock of Wisdom somehow.
And Diamond.
You are very inspiring and also a creator of new thoughts and wisdom. I really appreciate having the session with you both, particularly in sharing with us your insights and visions of what our future health systems should encompass and how we should seek to move forward to develop more effective and responsive healthcare in Asia. Good night and see you at our next episode, where we will have our expert friends from Japan to talk about Asia's future healthcare. Until then, stay healthy and safe. Goodbye, everyone.
Thank you.
Uh,
Bye-bye.
Bye.